Greetings, Madison College friends. It's Kristen Gebhardt in Human Resources, and those of you who have already looked at the open enrollment information video, welcome back. And if you haven't looked at the health insurance changes video, I highly recommend that you do that so you can kind of see what's coming up this summer. So this presentation is regarding health insurance and the basics. We talk all the time here in HR and in the benefits world about HMOs, PPOs, and copays, deductibles, coinsurance, all that stuff. What's a PCP? And you sometimes forget that that's kind of our lingo, and sometimes it helps just to see how all that works together. So this is what I'm trying to do in this presentation. So let's first look at an HMO, which is what GHC is. And that's really a type of health insurance with consisting of doctors and other medical providers. They offer care for a flat monthly rate and normally with no deductibles. However, that as time goes on seems to be changing. There are many HMOs now that do have some deductibles, but right now ours here do not. Our GHC plan does not have a deductible. So all visits, prescriptions, other things must be approved by the HMO to be covered. So there is no out-of-network coverage per se. So you'd have to be within the HMO to receive a covered service. PPO, standing for the Preferred Provider Organization, is an organization that is composed of physicians, hospitals, and other types of medical providers that they provide health care at a reduced fee. So WPS would be our PPO, and so what WPS will go is go out to groups of doctors or clinics and things like that and look for reduced fees for them to be part of in-network services. So they've got people who do that all the time, and that's why you'll see some people entering a PPO and some people, maybe some clinics leaving a PPO. The thing that makes a PPO more expensive is that it does allow for out-of-network coverage. So it's more expensive, but you will still have a portion of it covered as opposed to an HMO who does not have out-of-network services. And there is always usually a deductible in that PPO model. And I also get asked quite a bit by people, why do we have a PPO? Why don't we just have 3 HMOs? And to answer that question is, first, we're in a 12-county district. Madison, Dane County, and the counties surrounding Dane County are very HMO heavy. That's true. We have a lot in the Madison area. However, you get closer out to the eastern region, Watertown, and Fort Atkinson, and towards the Milwaukee area, there aren't nearly as many HMOs. So to be able to cover everybody, we have kept this PPO, which is also why we've offered some narrower PPOs to keep that cost down. And we also have a GHC clinic where we have worked with WPS and GHC to offer reduced services through WPS to be able to use that. Adding other HMOs would not help the current model that we have. So there's part of the answer to that question. So we often look at the deductibles. So that is just a flat amount a member must pay before the insurance makes any benefit payments. So right now, as I said before, GHC or HMO, there is a zero deductible. And then you look at the different various WPS plans. Keep in mind, though, if you are having a service that's considered preventive care, you're not even going to be subject to that deductible. So keep that in mind. That information I went over in the other informational video. Then you look at coinsurance. Coinsurance really is cost sharing. So you are sharing in the cost of a medical procedure of some sort or a visit. So you pay a certain percentage, and then all other medical expenses after that, after the deductible amount has been paid. So first you're going to pay that deductible, and then you're going to have some cost sharing after that. Again, with GHC, you're not worrying about coinsurance. That's really the PPO thing. So you're looking at that 10% in-network or 30% out-of-network coinsurance cost for most of the WPS, unless you're in the most expensive plan, which is WPS statewide Dane. It's a little bit higher. But then you've got a copay, right? What's the difference? So that's just a flat fee again that you pay at the point of service. Another cost-sharing mechanism, but it's usually like a one-time thing. Normally, you're going to look at that for office visits and prescription drugs. So we have kept them fairly similar between the two plans. You do see a difference in the specialty drugs between GHC and WPS, but otherwise they're pretty much the same when it comes to that. But again, it's usually just at the point of service, you'll receive a copay. Now again, like I said with the coinsurance and the deductible, if you are there for a preventive care service, there should not be a copay. But it has to be coded that way, and that's done by the clinic or the hospital. Then you look at an out-of-pocket maximum. So that's the maximum amount that you're going to have to pay out of pocket for healthcare services during a time period. For us, it's January through December, a 12-year calendar year. So that is your out-of-pocket max. So after you have hit the deductible and you've had some coinsurance, so on the WPS plan, you're going to hit that ceiling, and as you can see what those amounts are there, then there's going to be no more out-of-pocket maximums. However, copays do not add up, so those are outside of that. And I'll go over that in another slide. If you look at GHC, it's a standard max set by the Affordable Care Act. Well, there's not a lot of costs coming out of the GHC plan anyway, but the Affordable Care Act set it out as for a single plan $6,850 and a family plan $13,700. But that's almost unheard of in the GHC plan since there aren't any coinsurance or deductibles. So how does it work? So first you're starting again, and mainly here on the WPS plan we're talking, you start out with your deductible. Okay, you make that deductible, you're still going to pay some coinsurance, some copay on a visit. So, but if you hit the out-of-pocket max, then you're done. There is no more out-of-pocket. The plan will pay 100% in those visits. But as I said before, copay does not apply to the WPS deductible or the plan's out-of-pocket max. So you're still going to have the prescription copays, and you're still going to have the office visit copays or the ER as well. So keep that in mind. But we do have a fairly low out-of-pocket max. So the amount that someone has to pay out-of-pocket for lots of medical services still we feel is a reasonable amount for the employee and their family. So primary care providers, or a PCP, those are really a non-specialty medical provider. So some examples of primary care would be a family practice or general medicine doctor, internal medicine, OB/GYN, pediatrics, and psychology and psychiatry. So primary care, again, would be considered a non-emergency office visit. Specialty care, there are all the other providers not listed, right? So there's a larger list here, but some of those do include, such as a chiropractor, ophthalmologist, optometrists, surgeons, those types of things. Those are considered specialty care providers. And these are examples. I obviously do not have a complete list here. But I've been talking a lot about preventive care services on these other past slides where there is no copay, deductible, and coinsurance when you're in network for those services. So again, the biggest thing is that how that visit is coded at either the clinic or the hospital where you're at. So those annual physical exams, immunizations, those types of mammograms, cancer screenings, all those should not have any of the copays, deductibles, or coinsurance added to those bills. But the insurance company is going to pay what is coded by the clinic. So just keep that in mind, and you certainly might want to ask your physician, how is this being coded? Is this a preventive care visit for me? But the full list, if you want to look at all the different types of preventive care services, and this is created out of the Affordable Care Act, take a look at healthcare.gov. Also, again, as I said in my other video, all of our plan details are posted online at in the Fax Staff webpage, and look for that blue umbrella if you've got more questions. And again, the mailing will be going out at the end of May, and you should have also paper copies of all the information, including the new rates and more detailed things coming to your home address. So watch for that. But all the same information will also be posted online. So again, Workday, if you've got questions on just basic Workday and how to get in there, check out the help desk, give them a call. The open enrollment should be in your inbox. It should be an inbox to-do list, so make sure that you look for that starting June 1st. It won't be in there before. And confirm all of your choices and take a look at what you have. If you're not planning to make any changes, please still go into Workday and confirm those elections that you already have. Benefit plan questions on anything that I've talked about, make sure you do look at the literature that we'll be sending you, but also contact HR at our main number or our main email box, and we will make sure that those questions are answered. We have several people that are able to give you some help. So hopefully that gave you a better idea of all those different terms, and I hope you have a wonderful rest of the day. Thank you.